this interview, and I'm grateful that you have given me this opportunity. Um, I'm actually international medical graduate, who, like many people who write USMLE exams and go through the journey, which is a tedious journey and hard, and sometimes seems to be impossible. But like any other IMGs, I've also made it to this stage. So I'm very lucky to be part of your channel, to give my side of story and give some tips to this younger generation who are aspiring to uh, take up the journey of USMLE and into residency in United States.
Yes, sir. Thank you. Thank you for the insight. So talking about your journey, so now I have actually seen most of your journey that you are now sharing to these students that are now applying for the residency program in the United States. So please tell me, how are you helping students to match into their dream residency programs?
Right. So, see, my journey started when I graduated in 1995. Then I took up a job in one of the Caribbean countries called Jamaica. Most people are aware of that, through cricket. Um, that's why that journey started that way, not directly to US, was due to financial constraints those days. So I had to take a detour to Jamaica and then work for many years there before I could achieve my dream, which is coming to this country and doing my residency in 2010. And after graduating from my residency in 2013, then I started my journey as a faculty member, and presently I am the associate program director of a residency program here. So what I wanted to say is, sometimes it might not be an easy journey. In fact, most times, some of us get it easily, but again, at the end of the day, it's the struggle is worth it. But you got to put all your hard work. You got to give your 100%. That's the main focus. And having gone through this journey, I know what are the difficulties international medical graduates face. So that's why I've taken up this as a challenge to make sure that every IMG should be matched. No IMG should go unmatched. As much as I can, I will help people from the international medical community to see how they can pursue their dream, getting into the USMLE and getting their residency here. So I started this mentorship program so I can help these people in whatever way I can, all right? Whether it's tips to study or how to apply to the programs, give some basic knowledge about what USMLE is, and how to help them craft their CVs, all right? And how to do an interview, what are the things they should be looking for. So basically, some basic stuff which many IMGs really think that it might not be important, or they do not pay so much attention. The focus mainly among IMGs is how to get the USMLE's test exams done and get a good score. But there is much more than that, which most IMGs don't know or not aware of. That is important.
Yes. Thank you for that insight. And I really think that your expertise in this matter is really going to help a lot of international medical graduates worldwide to achieve their dream residency program in the States. So,
Thank
what are some of the things the programs look for in an applicant when they apply for the match?
Yeah, that is a fantastic question. First of all, most IMGs, as I said, are concentrating a lot about what is important for USMLE exams. All right, but the most important thing about an applicant or a residency match is what are the programs actually looking for? All right. So what do programs look for? This is very, very important. For example, I will tell you, uh, the NRMP, right, that which is the main body which conducts this matching process, right? They conduct a program director survey, and this survey is conducted every 2 years, right? And this survey provides invaluable insights into the factors that program directors across the country consider when selecting applicants for interviews. All right. So the last survey, which was done in January of 2022, and again, all of this is available on their website. A consistent pattern has emerged in the top factors that program directors or the programs look for. And these factors, and again, ranked by their importance, all right? The number one is letter of recommendations in the specialty, right? Number two is, of course, at that time, January 22, when it was published, USMLE step one score was important, but not anymore now. But that anyway was the second most important factor that the programs looked for. High scores on these exams. But since it is pass or fail, let's pass that. So the third was performance evaluations in medical school clerkships. All right, that was the third factor they looked for in the in the ERAS application. And the fourth factor was USMLE Step 2 CK scores. Now this has become very important because that's the only score which is objectively available for programs to evaluate candidates since the USMLE Step 1 has become pass or fail. Right. So the next one is the personal statement, because the personal statement actually provides a glimpse into the applicant's uh, motivations, aspirations, and dedication to the specialty they're applying for. Right. Then the sixth factor is any failed attempt in USMLE or complex exam, because a failed attempt can raise concerns about the applicant's academic ability and preparation. So that's important. And the seventh factor is perceived commitment to a specialty. How committed are you to the specialty you're applying for? How passionate are you about your specialty? Is the applicant dedicated towards the specialty? That is what they're looking for. And the eighth is what are your grades in your clerkships during your training in med school? All right. And the next one is the evidence of professionalism and ethics. All right. The program directors value applicants who demonstrate high levels of professionalism and adhere to ethical standards. And the last one, which is equally important, is interactions with faculty members. All right. What are the positive interactions with faculty members, which can be indicative of important clinical skills or interpersonal skills, I mean, sorry, rather, which are essential in team-based healthcare environment. So these are the 10 factors which programs look for in a candidate.
Yes. So talking about personal statement, how important do you think personal statement is, and how an applicant can craft a stellar personal statement?
Right. So I'm glad you're asking me some important questions here because personal statement is very, very important. All right. So a lot of people, in fact, from where we are trained, we are not used to writing a personal statement. We are most of the times IMGs are not aware of what a personal statement is. All right. So crafting a very good, compelling personal statement in a residency application is a critical task. All right. This personal statement actually serves as a window for the program directors. That is very, very important. And it also provides them an insight into who you are as a candidate. What is your journey in medicine and the passion that drives you towards your chosen specialty, right? I'll give you some tips about what a personal statement should be and what are the programs looking for. All right. Most importantly, the candidates who are applying for the residency programs, they should start the personal statement very early and plan ahead into their residence applications, because the process of creating a meaningful personal statement is not one that can be rushed, all right. Yeah, it's essential to start the process well ahead of the application deadline, right? Then the second thing is you need to reflect your journey in that personal statement. Your journey to medicine is unique and holds the key to why you choose your specialty. All right. So the reflecting your journey in the personal statement is very, very important. Things like you should recall the significant experience you have had during medical school. And also think about the key moments that shaped your career aspirations and use these reflections as a foundation for your personal statement. And the other thing is you need to showcase your passion. All right. All right. Passion is a driving force in any profession. And in medicine, it is no different. All right. Show your passion for your chosen specialty by sharing specific experiences like patient interactions, research projects, or clinical rotations that left a mark on you and influenced your decision. So that is important. And you need to be very authentic and genuine. All right. Authenticity in a personal statement is very compelling. You need to be very genuine. And the other thing is you need to highlight your strengths, showcase what you bring to the table. All right. That is very, very important. Highlight your strengths. All right. Skills and also your qualities that make you a perfect fit for the specialty and the residency program you are applying for. Right. This could be your clinical skills, your research experience, your leadership abilities, your teamwork, all those things. And the personal statement should be like you should tell them like a story, because stories usually engage and captivate readers. That is very, very important. And tailor your statement to each program, what you're applying for. Although the core content of your personal statement should remain consistent, it's crucial to adapt the statement to the specific program and specialty you are applying to. Right? Do some background research on each program's mission, values, and unique characteristics of the program. Then explain why you're a good fit for them, highlighting how your goals align with their philosophy. All right. And keep it concise and focused. Clear, concise writing is powerful. Right. You need to be, the aim should be clarity and conciseness. All right. In your personal statement. And when you do the personal statement, seek some feedback, make some revisions. There are a lot of people who want to help you. All right. But the core content is what you should decide what fits your passion. Right. And the feedback is the integral part of it. All right. You can solicit feedback from mentors. I give feedback to a lot of mentees who come to me about crafting their personal statements. And I give my opinion, right? Either you can come to mentors like me or faculty advisors, So there's a lot of help ahead. And lastly, but not least, proofread carefully your personal statement. And meticulous proofreading is crucial. All right. Proofread your personal statement carefully to catch any errors in grammar. Simple things like grammar, punctuation, or spelling, right? Attention to detail not only improves the quality of your statement, but also demonstrates your professionalism and commitment to excellence. So these are some of the things about your personal statement you should be very careful about.
That is some really nice advice about the personal statements, and we have shared a lot of practical implications of how we should craft a very good personal statement. So earlier you talked about the importance of letter of recommendations. So now let's talk about the US clinical experiences. What are your thoughts on observerships and hands-on USCs? Because many IMGs are not actually able to gather hands-on USC and they opt for the observerships. So how an IMGs can get these US clinical experience, and how does a program sees observership as a US clinical experience?
Okay, so that's a great question. I get a lot of questions about this particular topic, all right, which is very, very important. So gaining clinical experience in the United States is crucial for international medical graduates, especially who aim to impress admissions committee. All right. So here is why clinical experience is very important. One, are you familiar with the US healthcare system? This is what they're looking for. All right. Clinical experience in the US offers first-hand exposures to its healthcare system, its practices, its protocols, and its patient populations. All right. This familiarity shows admissions committee that you comprehend the subtleties of practicing medicine in the US and are prepared to handle its complexity. Right. That's very, very important. How familiar are you with the healthcare system? The second thing is adaptation to the cultural and professional norms here, right? So what that means is immersion in US clinical settings enables you to adapt to cultural and professional norms, right? Including communication styles, your teamwork dynamics, and your patient interactions. So demonstrating cultural competency and professionalism is vital in building rapport with patients, your colleagues, and faculty members. A quality, a quality highly valued by admissions committee. All right. So that's very, very important. Then what are your clinical skill development and enhancement? So clinical experience in the US allows you to develop and refine your clinical skills under the guidance of an experienced practitioners. Right? When in my program, we do get certain medical students who come and rotate with us, and they get first-hand experience in the clinical skill development and enhancement. All right, exposure to a diverse range of patient cases, medical technologies, and treatment modalities is very, very important. Then the other part is letter of recommendation and references. So US clinical experience offers opportunities to build strong relationship with attending physicians, residents, and faculty members who can provide persuasive letters of recommendations for you. All right. Positive LORs from US clinicians serve as endorsement of your clinical abilities, your professionalism, and readiness for residency, which can significantly bolster your residency application. Right. The other thing is networking and mentorship opportunities. Like I mentor a lot of IMGs to achieve their goals. So when you're doing your clinical rotation, if you get hold of a mentor who can help you, who can nurture you, all right, that will really enhance your chances of getting into your residency, because you will be guided pretty well through the process. That's why building connections with medical community can offer valuable guidance, and it also gives you some support and career advancement opportunities. All right. Then understanding of patient-centered care. Right. U.S. clinical experience highlights the importance of patient-centered care, empathy, and patient advocacy. Right. This allows you to display your commitment to and compassionate patient-centered care. Right. Then the lastly, which is very, very highly valued here, is integration of evidence-based medicine. All right. Exposure to evidence-based medicine practices in US clinical settings emphasizes your ability to critically evaluate medical literature, apply research findings to clinical decision making, and practice evidence-based medicine. This skill set is highly valued by admissions committees who see candidates capable of keeping up with advances in medical knowledge and incorporating best practices into their clinical care. So bottom line, what I'm trying to say is obtaining clinical experiences in the United States not only strengthen your clinical skills and cultural competence, but also offers opportunities to build relationships, receive strong LORs, and demonstrate your readiness for residency training. Right. So this is how personal, clinical experience in US makes it very important, and it should be one of the critical tool for your residency application.
Yes, thank you for the insight. So, what are your views on observer series, which are not hands-on USCs?
Yeah, so the main important is you don't need to show your clinical knowledge during your observership. All you need to understand is, are you inept with how the system works here in the United States? All right, you get to see, you get to observe diverse patient population, diverse pathology. You get to meet people who work on front end level like residents, and you get to communicate with them. So even though it is observership with not much of active clinical experience, but the amount of non-clinical knowledge you're going to gain from observerships is highly important, because it's very important to understand how the system works here. And you also build network when you're doing observerships. Don't discount that. That is very, very important too. Networking and building connections and impressing. Observership doesn't mean that you can't get involved into clinical discussions. So these things are very, very important.
Yes, sir. I think most of our viewers will be relieved with that answer.
Yeah.
So, how to get a great LOR out of this clinical experience?
So this a lot of people ask me these questions. All right. So what is the importance of the letter of recommendations? Of course, most international medical graduates look at clinical experiences mainly for LOR, but I don't think you should look at it from that standpoint alone. Of course, you're going to get some form of letter of recommendation, but obtaining a strong LOR during your clinical rotation or observership is crucial for your residency match. I'll tell you why. I'll give you some detailed explanation. This is very, very important. There is a lot of misconception about a letter of recommendations. People, I've seen people coming up with. All right. Number one is you build strong relationships. All right. What that means is, when you're doing your clinical observership or rotation or clerkship, whatever you want to call that, start by establishing rapport with your supervising physicians, residents, and other healthcare team members early in your rotation, right? Be very proactive, reliable, and engaged in patient care and clinical activities. Just because you're an observer and you're not going to talk to the patient, not examine patient, doesn't mean you can't demonstrate these skills. You have to show professionalism, and you have to show, most importantly, the enthusiasm and the willingness to learn. That is very, very important. So building strong relationships is very, very important. The other thing is, seek feedback regularly. All right. Request feedback from your preceptors or your supervisors periodically throughout your rotation. Right. This demonstrates your commitment to improvement and allows you to address any areas of growth and promptly correct them. Right. Actively incorporate feedback into your practice. All right. That's one thing. And the other thing which I've noticed among IMGs is they really don't show initiative. You have to show initiative in your approach. All right. Volunteer for additional responsibilities and opportunities to expand your clinical skills and knowledge. You need to express interest in participating in research projects, quality improvement initiatives, whatever you can do. It's not just about clinical care. You got to participate in educational activities. All right. Then, when it comes to engage in patient care, you need to show your clinical knowledge, even if not talking to the patient and examining the patient. All right. So build a very professional portfolio. That's what I will say. Keep a log of your clinical experiences. All right. Collect any positive feedback or commendations you receive. And you need to clearly communicate your goals. All right. You need to communicate your career goals and especially interest, your field of interest, right, in your rotation. And you need to discuss your aspirations for residency training. And you also need to inquire about opportunities in that program, whether you will be a fit for that program. Some of these observerships, what IMGs come and do, maybe the program is looking for a good candidate when they observe IMGs. So you should be very, very, very careful about that. All right. And request letters strategically. I mean, you identify a faculty member who can provide strong personalized recommendations based on their direct observation of your clinical performance. Choose preceptors who know you well and speak to your clinical skills. All right, your worth ethic, interpersonal qualities, and you need to provide necessary information and follow up and express gratitude, and you need to stay organized and plan ahead. So these are some of the things you need to inculcate to make sure you get a pretty good LR. If you follow these steps and actively engage in your clinical rotations, you can increase your chances of securing an outstanding letter of recommendation that highlights your strength and readiness for residency training. Remember to approach the process with professionalism. You have to show your enthusiasm and genuine commitment to excellence in patient care. So these are very, very important things.
Thank you for the answer. So let's talk about the importance of research in ERAS application.
Okay. So in my experience as a mentor, a lot of people ask me about um, what is the importance of research in ERAS application, right? So in my days, probably research was not such such a great importance, or did not play much of an importance. But over the years, evidence-based medicine has taken a front seat, right? Because we are seeing in clinical practice in the United States here, practicing evidence-based medicine is not so easy, right? It's hard to follow the guidelines, right? So in the competitive USMLE residency match landscape, right, research publications significantly enhance an applicant's candidacy and impress admissions committee. All right. So, what is the importance of research publication? No, the most important thing is it demonstrates academic achievement, right? Research publications demonstrate your academic prowess and ability to contribute to scientific inquiry and discovery. So that is very, very important. And it differentiates your application among other competitive applicants. The type of research you've done, you know, and it can help your application stand out. Right. It also strengthens your CV. Research publications enhance your curriculum wide and lend credibility to your academic credentials, right? And it also opens doors to opportunities, right? It can lead to networking opportunities, collaborations with respected researchers, and invitations to present your findings at conferences. So don't forget, that's important too. Now, the next question people usually ask me as I'm mentoring international medical graduates is, sir, what type of research publications are important? All right. What are the types of publications which need to be considered when we think about research? Nobody is looking for a PhD candidate. Well, they're not looking for you to have a 5-year PhD research publication prowess, because that's not what we are looking for. We are looking for simple things like peer-reviewed journals, right? Your publications in a reputable peer-reviewed journals are highly valued by residency programs. Then sometimes we also look at original research articles. Publishing original research shows your ability to design and execute scientific studies and your ability to analyze data and draw meaningful conclusions. So that's important too. The other thing is the review articles. All right. Review articles offer comprehensive overview of specific topics within your field of interest. Then case reports or case series. All right. These case series or case report describe unique or rare clinical cases, right, providing valuable insight into diagnosis or management or outcomes, right? So letters to the editor or editorials, these are important. So in conclusion, research publication are crucial in USMLE residency match application process. They showcase your academic achievements, differentiate your application, strengthen your CV, and create opportunities for professional growth, right? So you always aim to publish in reputable journals and consider the publication type that best aligns with your interests and your career goals, all right?
Awesome. Thank you for that. So, how does an applicant decide how many and which programs he should apply for?
Mm. So this is another great question, which usually I'm asked when I'm mentoring my IMGs. All right, because the common answer I get when I ask my mentees about how do you decide how many programs? They said, no, sir, we just broadly apply 200, 250 programs. And nowadays there is a new thing called signaling. All right. So a lot of the IMGs are actually wasting a lot of money broadly applying to programs, even not even researching programs, which fits their criteria, or what are the criteria, what are the philosophy of the programs. This is very important, and the candidates are not able to understand this equation. So deciding which and how many programs to apply is very, very important. All right. It's crucial to compare your work style, interest, and academic qualifications. All right. So let me give you a few things. This is important. All right. So it is advisable to have a conversation with your mentor. So having a mentor is very, very important when you're looking into which programs to apply, how many programs to apply, craft. And earlier I talked to you about personal statement, right? How to craft your CV, so on. So these are some things I will tell you. Consider applying to several programs spanning different tiers of competitiveness. So there are tier 1 programs, tier 2 programs, tier 3 programs. So this strategy will not only increase your chances of securing a match, but also broaden your exposure to diverse programs. So that is one thing. All right. Make use of resources like the AMA, that is Frida Online, and the SIM residency program profiles to research and compare residency program options. All right. So these platforms provide comprehensive information on various programs that can aid in making informed decisions. All right. It's also beneficial to review competitiveness data from the Careers in Medicine report. Okay, that is very, very important. And review the NRMP results of the applicant survey and the charting outcomes in the match report for detailed information about factors applicants should consider when you're selecting programs, right? Then the number of residency programs to which you should apply depends on various factors, right? One of the most important factor is the competitiveness of specialty. Some specialties are more competitive than others. With a limited number of residency positions available relative to number of applicants, and that highly competitive specialties may require applicants to apply to large number of programs. Then what is the applicant competitiveness? Right. One thing is to know about the specialty competence. What is the applicant competitiveness? So your competitiveness as an applicant, including factors such as your USMLE scores, clinical experiences, research, LORs, all that is very important. All right. Now, geographic preference. You should also consider whether you have a preference for specific geographic locations or regions. All right. So if you are open to relocating, you may have more flexibility. Then what are the program characteristics? It's crucial to research residency programs thoroughly to understand their characteristics, such as program size, academic reputation, clinical experiences, resident satisfaction, and fellowship opportunities. So apply to programs that align with your preferences and goals. A lot of the times I tell candidates, the programs already know what kind of candidate they want. Now you have to set a criteria for yourself and research programs and see which program fits your criteria, right? So that's very important. So that you don't get disappointed matching in a program where you don't want to go. Then you also have to look at application cost and resources. This is very, very important for IMGs, right? And you definitely have to take advice from an advisor or a mentor. This is highly important. This is where most IMGs miss this important thing. As a broad guideline, right? Many applicants apply to a range of 10 to 20 programs. However, this number can vary widely, right? So you need to also look for IMG friendly programs. Do they sponsor visa? All right. Then competencies of and match rates, networking and connections, right? So these are all important things. So in conclusion, IMGs should carefully research residency programs, taking into all the above things what I said. Then decide how many programs to apply. Just broadly spending $2,000-3,000 and applying everywhere really doesn't fetch you anything.
Thank you for the answer. So now, since step one is pass fail, what is the importance of step two score?
So that is a great question. A lot of the programs are in a big dilemma, and most of the programs still are unclear about how to screen applicants. All right. So here is what I'll tell you. My personal opinion based on what I have known and what I have read and what I've researched and what I've come up with. All right. As usual, as we navigate the complexities of the residency process, I want to emphasize the importance of step 2 CK. Trust me, this is the only objective score available to evaluate a candidate for interview spots, unfortunately. But again, the basic skill testing in USMLE step 1, pass or fail, it definitely has a big impact on how step 2 score is looked into, right? Because in recent years, the role of the USMLE step 2 CK score has significantly evolved. It has become a key determinant in the residency application process, all right? So in the competitive residency match landscape, securing an interview spot to top choice programs is increasingly challenging, because residency programs receive many applicants each year. So getting a good step 2 CK score will highly improve your chances of matching into residency program. One thing to talk about step 3, that also is very important. But since step 2 CK is about clinical knowledge testing, it is very important to get a very competitive score to secure a spot in the residency match, especially when the step 1 has become pass or fail, or if you have had a attempt in a step 1, you really have to prove yourself and show that your clinical knowledge is very competitive. So step 2 CK score will or is considered highly during the application process.
So earlier you talked about the failing in the USMLE step one as a red flag. So what are the other red flags that the applicants usually have in their applicants?
Oh my God. So this is uh, a long topic, but let me cut it short. All right. So um, see, in the process of reviewing residency applications, admissions committees employ a rigorous approach. That is for sure, right? They examine various factors, one of which includes scores, right? High scores on this exam can greatly enhance an applicant's prospect. But again, sometimes the application might not have a lot of positives, but most programs do look for red flags in the application. If there is a red flags, it's easy to eliminate the application. But if there a lot of good factors, it is hard to consider the application when it is so competitive, right? So let's look at what are the red flags from the vantage point of admissions committee. All right, these are some of the things which I think are very valuable red flags in the application. One is multiple attempts. Right? If an applicant has made multiple attempts at any step of the USMLE, this can be a cause for concern for admissions committee. Well, while it is understandable that an applicant may occasionally need to retake an examination, a recurring pattern of multiple attempts across various steps could suggest an underlying difficulty, right? So that's very, very important. Then the second thing is significant score discrepancies. This is very, very important. If there are large discrepancies between scores on different steps of the USMLE, this can raise questions about an applicant's consistency and overall preparedness for the demands of residency. What does it mean? For example, if an applicant achieves a very high step one score, of course, that is not now, but then follows this with a significantly lower step two score, this may cause concerns about the candidate's clinical health. Or if the applicant has, some programs have criteria that they're okay that you have an attempt, but after an attempt or after a failed attempt, how much have you improved in your uh, past attempt? If a passing score for a step two is 214 and somebody gets 213, but did they jump only by few points to 219 or did they jump to 242? So that jump is also what they look for, right? So, and other thing is low scores below specialty average, right? Every specialty, they have some averages, all right? If an applicant scores are significantly below the average for their chosen specialty, this may raise concern too. But trust me, failure to pass step 2 CK, that's the biggest red flag, right? Because that's the only objective way of evaluating residency applications nowadays, all right? Then the other thing is extended time to complete exams. People take their own sweet long time to do the exams, but again, their scores are not so great. You're taking 6 to 8 months to prepare for an exam, and you get a 220 score, and that's a concern too. All right. And again, as I said, lack of improvement and so on. So these are some of the things which are very, very important. And if an applicant does not address or explain the red flags in the application, such as low score or multiple attempts, this can be viewed unfavorably too. Right? If you have a valid explanation and a true explanation, you need to explain that. If you can't explain that, then that's a problem too. Right? So these are some of the things which are very, very important.
Now let's come to a sensitive and rather a realistic question. So, what if a candidate does not match?
That's important. All right, that is the reality of IMGs. Okay, so based on the NRMP statistics for the match years overall, the match rate for an American medical graduate is in the mid to late 90s, right? And the match rate for IMGs is in the mid to late 60s. So that's a very, very important question you're asking me. So what if you don't match? All right. One thing is nobody wants to be disappointed in that month of March, which is the match week, right? But again, unfortunately, good chunk of people go unmatched. All right. So after going through a lot of pain throughout the um, process of USMLE and residency, people still go unmatched. All right. So this is a very touchy topic. All right. I don't want to sound very negative about it, but again, reality is reality. People need to understand um, what are the possibilities. Of course, a lot of people are aware of SOAP process, which used to be called as uh, um, with a different name, scramble or whatever it used to be called before. So if you know that you did not match into the program, then you what connections you have made before or during the process of your residence application comes into play. All right, not not matching is not a sign of no progress. All right, there is a lot of people who get through the SOAP process. Right, so you need to build connections. You need to make connections with the programs. You need to call. You need to go and look up the NRMP statistics and see the data where which programs have not filled up. Contact those programs, right? Apply to those programs as soon as possible. Okay, because the SOAP process goes into different cycles, right? You make calls. If you have done observership in certain programs, call the programs, contact them, make talk to the residents, talk to the advisors. All right. Maybe if you have a good mentor, they can help you get through the SOAP process. But again, uh, disappointment is one thing, but letting go at that stage and not taking corrective action will be very, very disappointing and depressive. So there is a SOAP process, and there's a right way to do SOAP process. It's better to have a mentor throughout this USMLE journey so that you don't end up going through this non-match or SOAP process. And there is always a lot of help available, right? You have to pull up your socks, get up and start walking and put your 100%. If you put 100% in your in your journey, trust me, there is some door which opens for you, right? So don't feel disappointed if you don't match, right? You need to look at your CV. You need to take corrective actions. Where did I go wrong? Sit with your mentor or your advisor. Go through the process and try hard the next time again. There are a lot of people who go unmatched. Then they do match again. I understand not matching, going unmatched is not an easy thing for the next cycle. But again, it's not uncommon, right? People do match eventually in one specialty. Think over what is that you have done which made you. Sometimes you might have done everything right, but again, it's a matter of luck sometimes. It's a matter of the right approach. And in my opinion, if you have a right advisor or a mentor, things can become very easy for you to approach these things. Again, it's never hard. It's never, it's never easy, but it is not impossible either. Okay. We have all gone through this process. Yeah,
That is
that's what I
really
would say.
that is really a true advice to all of us. So let's talk about the year of graduation. So I am just tend to have year of graduation more than 5 years.
Mm.
So how does our program look into that?
Mm. So this is a very another uh, sensitive topic. All right. First of all, getting into a residency program can be tough for IMGs. We all know that. And more importantly, if you're completed your graduation more than 5 years ago. from the point of application. Most programs do have a cutoff of 3 to 5 years, though. That most IMGs should know that. But that doesn't mean that credible candidates who have a good CV and who have a good attitude towards their approach and who have very good mentor to advise them, it's not impossible. All right, let's look at these challenges. All right. So one is, what are the challenges? Why is that cutoff makes it so difficult? All right. It's pursued that knowledge gap. Okay. Residency programs may think you're not up to date with medical knowledge and skills when your year of graduation is more than 5 years. I mean, this is a perception, right? So you have to work with this, right? Then the competition. Newer graduates usually have more recent experience and academic records. That's a perception again. All right. And what are the program rules? Some programs have strict rules about graduation year and may automatically exclude older graduates. That's the screening process programs look into. So these are some of the challenges. So how do you improve your chances? All right. Now, you might be a long-term graduate, all right, more than 5 years. The important thing is get good USMLE scores. High scores, getting high scores on the USMLE STEP exams can show strong medical knowledge and ability. Remember the challenges we said? If you have more than 5 years, you are considered to have, one of the challenge could be knowledge gap. So you prove your knowledge gap by getting a good score, all right? And among the exams, passing step 3 shows it shows your residency and committed to practicing in the US. Sorry, my lips are dry. That's why I'm certain words are pretty hard to come out now. So passing step 3 is important, to prove that you don't have a knowledge gap. Then US clinical experiences, hands-on US clinical experience, getting clinical experience is very important. All right, and getting a good LORs. That's how you can correct your application. Getting a strong LOR from a US doctor can vouch for your ability and skills to practice in the United States, right? Then ongoing medical education, you do some courses and you certify yourself in courses related to your specialty, right? If you have any more degree or training after your med school, certain applicants have postgraduate training in their home country, right? So that is important too. And research and publications, as we talked about already. And the big one is networking and mentorship, professional connections, mentorship. You find a good mentor who can guide and support you. Right? I have mentored a lot of people who have had year of graduation or some deficiencies in their applications and who have done well during the residency process and have been and have matched and they are happily doing the residencies and some have completed their residencies too. All right, finding a good mentor is very important too. All right, then strong personal statement, right? Okay, and there are some programs with flexible rules, so you need to target those programs, apply to programs that are more IMG friendly and don't have strict year of graduation cutoffs. So you need to know that. So researching these programs, talking to your mentor is very important. All right. So and there are something called as residency prep programs for IMG friendly and transitional programs for additional clinical experiences. It doesn't hurt to getting into them. All right. So while it's challenging to match into residency program after a gap since graduation, it can be done with careful planning and proper mentorship and advice and hard work. All right. Excelling in USMLE exams, getting recent USL clinical experiences, and continuous learning and good LORs, right? Research participation, all these things, good things we talked about, will help you enhance your application, right? As I said, there is no one thing or one variable which can determine your success or failure in matching into residency. It's a culmination of things. And you need to project your strengths, show your strengths, right? That is the key thing about your application. Don't dwell on your weaknesses, right? Yeah.
That is a really good
What else do
insight.
you think about that?
So let's talk about signaling a program. So what does signaling a program actually mean?
So this is one big thing nowadays. So for international medical graduates, the journey of getting accepted into residency program in the United States can be a complex and challenging process, all right? One key strategy that can be very beneficial actually is signaling. This is a strategic method where applicants convey a strong interest in specific residency programs, right? Which can make them more noticeable to those programs, right? So let's look at what are these things, okay? Understanding the residency match process for IMGs in depth, okay? Application process. IMGs generally apply for residency programs through the ERAS. This is a centralized online application system, right? So examinations required. We know that step one, step two, English exam, ECFMD certification, and additionally step through. Okay, and the documentation needed. All right. Uh, so what is this signaling mean? All right. So what does actually the word signaling mean in terms of residency? This is a strategic action taken by an applicant to demonstrate their strong and genuine interest in certain residency programs. This can be very crucial for IMGs, actually, who often need to make themselves stand out from other applicants, right? What is the purpose of signaling? See, the ultimate goal of signaling is to alert a residency program of the high level of interest and commitment an applicant has, with the hope of increasing the chance of receiving an invitation, all right, or what we call an interview, and ultimately matching into the program. So that's the purpose of signaling, right? So what are the different methods of signaling we have, right? Some residency programs participate in supplemental ERAS application process, all right? I'm not going to go depth into that, all right? So then personal statements and letter of recommendations. Then direct communication, taking the initiative to send emails or letters to program directors is another way to express genuine interest. All right. Then post-interview follow-up. After interview, it's a good practice to follow up with thank you notes. Right. Now, what are the strategic considerations for IMGs? You need to research the programs. It's very important to identify programs with the history of accepting IMGs, those in locations that are welcoming to IMGs, or those that align closely with your background and experience. This is very, very important. You need to research these IMG friendly programs, right? Highlight unique qualities. Okay, networking. This is the key thing. IMG should consider attending residency fairs, joining relevant medical organizations, using professional social media platforms, right? So this is very important. So what is the role of signaling in the matching algorithm? So the rank order. Both applicants and programs submit a rank order list to the NRMP. By ranking programs highly, applicants are signaling their preferences. Similarly, programs also signal their preference by ranking applicants. Okay. So what are the potential benefits of signaling? So increased visibility, right? Then competitive edge if you have researched the program well, and better fit, because signaling can assist both the applicant and the program in finding a better fit. This is because signaling is typically done where there is a genuine interest and potential match if you have researched the program properly. But what are the cautions and best practices you should do when signaling? Limited signals. Use signaling very wisely. If a programs allow signaling only for a limited number of programs, choose those that you are genuinely most interested in. Authenticity. That is important too. Be authentic in your communication. Program can often sense insincerity, which could be detrimental to your application. And you need to have a very balanced approach. Combine signaling with other strong elements in your application, such as high USMLE scores, LORs, and so on. So you need to have a proper strategy. How do you get this proper strategy? You need a mentor for all of this to make things easier for you, right?
So I think that covers pretty much everything that is important.
Mhm.
So thank you for joining with us. Are there any last words that you want to convey to our audience?
Yeah, so I know there are a lot of IMGs who are thriving, who are working hard, they are putting in a lot of hours, sleepless nights, doing whatever it is possible to uh, be competitive, to get through this USMLE and do the right work, getting into clinical experiences, LORs, personal statements. But again, as I said in the beginning, it's not easy. It is very important to network, communicate, uh, get linked to an advisor or a mentor, which will make your life very easy. I've seen this throughout my academic career, where I have mentored many IMGs who have been successful and they're happy with the type of mentorship me and some of my colleagues have provided. So if there's anything you can do to enhance your chances of getting into residencies in the United States, please do get a mentor and take proper advice. That's what I would say,
Yes.
if
Thank you.
possible.
And to everyone watching, if you are looking for mentorship, you can talk directly to Dr. Satya, and I will keep down a link to his contact in our description box. So, Dr. Satya, thank you for being here today, and that was a really informative interview with you.
Thank you, Avraj, for giving me the opportunity. And I hope your listeners will enjoy the discussion we had. And I'm sure at times I go a little bit lengthy, but again, these are very important for IMGs. I know the struggle what the IMGs put into, and I'm very happy that you're helping a lot of IMGs through your good work. Continue to do the good work.